Go ahead, Zach.
Hello, and welcome to the Ohio Medicaid Basics 2021 webinar. I'm Zach Reet. I'm the Director of Data Management and Analysis at the Health Policy Institute of Ohio. And again, thank you for spending this time with us to learn about Ohio's Medicaid program. The mission of the Health Policy Institute of Ohio is to provide the independent and nonpartisan analysis needed to create evidence-informed health policy that improves health value. I want to take a moment to thank our core funders who advance our mission through their generous support for our work. We encourage you to engage with HPIO on Twitter and LinkedIn. We love sharing information through various formats, including through social media, and keeping the conversation going on these platforms. The presentation slides and other related resources are available on HPIO's website on the event webpage for this webinar. Ohio Medicaid as a program provides healthcare coverage to over 3.1 million Ohioans, and it accounts for about 38% of Ohio's budget. And given the size and the scope of Ohio's Medicaid program, it's a significant driver of health policy in our state. And today we're going to share information from our latest publication, Ohio Medicaid Basics, which is updated every 2 years. And this document provides an overview of Medicaid program eligibility, covered services, delivery systems, financing, and spending. And Stephen Listison, who's an assistant health policy analyst, was primary author on this brief, and he's going to be presenting this information today. Stephen is a graduate of the John Glenn College of Public Affairs at The Ohio State University, with a Bachelor's of Arts in Public Management, Leadership, and Policy, with a focus on social policy, and he also has a Master's of Public Administration. So now I'll turn it over to Stephen.
Thanks, Zach. As Zach mentioned, Ohio Medicaid Basics is published by the Health Policy Institute of Ohio every 2 years to coincide with Ohio's biennial state budget. The publication provides a foundational summary of Ohio's Medicaid program. In addition to the topics that Zach outlined, the brief also examines how the COVID-19 pandemic impacted Ohio Medicaid and discusses recent and significant changes to Ohio Medicaid in the past year. The publication's 3 key findings are: Ohio Medicaid provides access to healthcare services for about 3.18 million low-income Ohioans, including many individuals who cannot afford private or employer-sponsored health insurance. The second key finding is that Medicaid is a significant share of government spending in Ohio. In state fiscal year 2020, Medicaid expenditures from state and federal funding sources accounted for about 38% of the state's spending. The third and final key finding is related to key change aspects of how Ohio Medicaid operates. Over the past year, Ohio Medicaid has implemented changes to streamline administrative processes, increase transparency, and improve access to care and care coordination for Ohioans. Going forward, Ohio policymakers should monitor implementation and evaluate recent changes to the state Medicaid program. The Medicaid program is, at its core, a partnership between the federal and state governments that pays for healthcare services. The federal government finances a significant portion of state Medicaid programs, and in turn, states are required to provide coverage for certain federally defined eligibility groups, which I'll discuss later in further detail. As shown in the pie chart, as of March 2021, 27% of Ohio's total population, or more than 1 in 4 Ohioans, received healthcare coverage through Medicaid. For this reason, the Medicaid program is a critical piece of the health policy landscape in Ohio. And since Medicaid is the payer of healthcare services for more than a quarter of all Ohioans, Medicaid can be leveraged to make large-scale policy changes that significantly impact the health of Ohioans. Ohio Medicaid pays for the healthcare services of children, older adults, pregnant women, parents, childless adults, and individuals with disabilities who enroll in the program. In addition, all Medicaid beneficiaries also have low incomes. Now, before we dive into the nuances of Medicaid financing, eligibility, and covered services, let's look at the difference between Medicaid and Medicare. Unlike Medicaid, which is funded and administered through a partnership between the federal government and states, Medicare is a fully federal program. Eligibility for Medicare is not based on work history and age or disability status, and there is no income limit for Medicare coverage. Finally, Medicaid is funded through income taxes and other fees, whereas Medicare is paid for through payroll deduction. Some people are covered by both Medicare and Medicaid, and those people are referred to as dual eligibles. I'll discuss them more later in the presentation. Medicaid is financed jointly by the federal government and states through a payment arrangement called the Federal Medical Assistance Percentage, or FMAP. State spending on healthcare services provided by Medicaid are matched by the federal government at a rate between 50 and 78.3%. States are also eligible for enhanced FMAP, or EFMAP, for some children, as well as people enrolled in Group 8 of Medicaid eligibility in Ohio. Lastly, Ohio's FMAP for federal fiscal year 2022 is 64.1% for most enrollees in the program. In the past year, the Ohio Department of Medicaid, as I earlier referenced, has engaged several vendors to streamline administrative processes, increase transparency, and improve access to care and care coordination for Ohioans. Two of the most recent and significant changes to the Ohio Medicaid program are the creation of Ohio RISE and managed care procurement. Ohio RISE represents a new approach to care coordination for children and adolescents enrolled in the Medicaid program who have serious behavioral health needs, and this program provides expanded treatment options and support services across systems. Ohio RISE will also aim to end the practice of parents needing to relinquish custody of their children with complex behavioral needs to access appropriate care for these children. Managed care procurement included a renegotiation of contracts between managed care organizations, or MCOs, which are responsible for providing services to about 88% of Ohio Medicaid enrollees, and the Ohio Department of Medicaid. Managed care procurement is expected to save costs for the state, ensure better care coordination and benefit provision, and address social determinants of health, equity, and population health. However, both Ohio RISE and managed care procurement may be impacted by pending provisions under consideration as part of the current state budget bill, House Bill 110. Other changes to the Ohio Medicaid program that have been implemented as of recent include enlisting a vendor, Gainwell Technologies, as a fiscal intermediary and as a single pharmacy benefit manager for the Ohio Medicaid program. These changes are discussed in further detail in the full Ohio Medicaid Basics 2021 brief. Medicaid Basics 2021 also highlights the pervasive impacts that the COVID-19 pandemic had on Ohio's Medicaid program. In Ohio, Medicaid enrollment increased by approximately 13.6% from March 2020, just before the impacts of the COVID-19 pandemic began to be felt, and March 2021. This increase in enrollment also represents a reversal of the previous downward enrollment trend in Ohio Medicaid from 2017 to 2020. And in response to increased enrollment in Medicaid during the COVID-19 pandemic, the federal government provided states with a 6.2% increase in the federal share of Medicaid spending, giving states a metaphorical cushion for financing Medicaid amidst an increase in enrollment. However, this enhanced FMAP provided to states by the federal government during the COVID-19 pandemic is contingent on a maintenance of eligibility or MOE requirement. The MOE requirement means that states must maintain eligibility for individuals served by Medicaid until the end of the federally declared PHE or public health emergency. As of today, the public health emergency is still in place and will likely remain in place until the end of 2021. Finally, the COVID-19 pandemic also brought administrative challenges to Ohio Medicaid and other state Medicaid programs, including employees adapting to the nature of telework and employees managing a vast increase in applications for Medicaid enrollment. To be eligible for Medicaid, people must reside in a household with an income below a specific amount. For most enrollees, the income eligibility limit is set as a percentage of the federal poverty level, or FPL, and eligibility is based on household modified adjusted gross income. Specific information about Ohio Medicaid eligibility by income is included in full in Medicaid Basics 2021, the brief. The graphic shown on the screen summarizes basic information about Medicaid eligibility in Ohio. On the left, it shows the first steps of Ohio Medicaid eligibility. In order to be eligible for Medicaid in Ohio, a person must have or apply for a Social Security number, be a US citizen or meet Medicaid requirements for people who are not US citizens, and be an Ohio resident. Now, in some cases, disability status and medical conditions are considered during the eligibility determination process, and I'll discuss that more in a moment. Additionally, the Medicaid program looks at assets such as stocks, bonds, and real estate. However, there are some exemptions for some assets, including a person's primary residence. Finally, for the purposes of reporting, federal reimbursements, and administration, Medicaid beneficiaries are enrolled in different categories of Medicaid based on specific characteristics, which I will discuss now. The three categories of Medicaid eligibility in Ohio are covered families and children, or CFC, Group 8, which I referenced earlier, and aged, blind, and disabled, or ABD. The groups covered in covered families and children, or CFC, are shown on the screen. These are children, pregnant women, and parents. The pie chart shown on the screen shows that as of March 2021, enrollment in the CFC category included more than 1.22 million children and almost 550,000 adults, representing a significant population of the Ohio Medicaid program. In January 2014, Ohio Medicaid coverage was expanded to include adults ages 19 to 64 who are not eligible for other categories of Medicaid and have incomes less than 138% of the FPL. This population is known as Group 8. Enrollment in Group 8 has grown significantly during the COVID-19 pandemic. For context, in March 2020, enrollment in Group 8 was almost 617,000 Ohioans. And for comparison, enrollment in Group 8 as of March 2021 was about 775,000 Ohioans, representing about a 150,000 Ohioan enrollment increase over the year. The groups included in the aged, blind, and disabled category are people over age 65, people living with disabilities, individuals eligible for the Medicaid buy-in for workers with disabilities, and people who are eligible for both Medicaid and Medicare, as I said, who are referred to as dual eligibles. And to be enrolled in the ABD category, a person must be over 65 or determined disabled by the Social Security Administration. It's important to note that Medicaid spending varies by eligibility category. Many individuals enrolled in the ABD category of Medicaid, for example, have significant healthcare needs that are very expensive to treat. Therefore, spending associated with this population is proportionally higher than for the other groups of eligibility that I just discussed. Additionally, the appendix of Medicaid Basics 2021 provides a more in-depth description of the other categories of Medicaid eligibility in Ohio, of which, as shown in the bar chart on the screen, only account for about 4% of Medicaid enrollees as of 2020 in Ohio. States are required to provide federally mandated benefits, including the essential health benefits by the ACA and early and periodic screening, diagnosis, and treatment services for children. Ohio Medicaid provides additional services that are not federally mandated, including vision and dental care, prescription drug coverage, and most recently, telehealth. In March 2021, Ohio's Medicaid monthly enrollment was about 3.18 million Ohioans, as I referenced earlier. The line graph shown on the screen shows that there was a peak after a few years of declining Medicaid enrollment in the state. Medicaid enrollment in Ohio is impacted by a number of factors. During periods of economic downturn, unemployment and underemployment rise, income stagnate, and people turn to safety net programs like Medicaid, which leads to increased enrollment. As we discussed earlier, we saw this happen largely due to the wide-ranging impacts of the COVID-19 pandemic over the past year. But the opposite can also be true. A strong economy can lead to reductions in Medicaid enrollment as people return to work more hours, or earn higher wages. And in addition to events and occurrences like the COVID-19 pandemic, policies such as the expansion of Medicaid eligibility to adults without dependents in 2014 can also impact enrollment. Medicaid Basics outlines 4 reasons that people enroll in Medicaid as opposed to other types of healthcare coverage. These include unemployment, divorce, or other changes that impact coverage, like leaving work to take care of a child or relative, high prices for private individual health insurance, low rates of employer-sponsored health insurance, and the need for long-term support services like care in a nursing home, which is not covered by Medicare and most private health insurance. Medicaid coverage is provided through managed care plans, better known as MCPs, or a fee-for-service arrangement, or FFS. MCPs are privately operated health insurance companies that contract with providers, such as physicians and hospitals, to deliver Medicaid-covered health services to enrollees. As of March 2021, shown in the pie chart on the screen, 88% of people receiving full Medicaid benefits were enrolled in an MCP, 7.4% of people receiving full Medicaid benefits were enrolled in fee-for-service coverage, and the remainder of Ohioans receiving Medicaid coverage received limited coverage, which is classified differently by ODM than the other 2 enrollment coverage options. Lastly, I'll discuss spending on Ohio's Medicaid program. The total spending on Ohio's Medicaid program in state fiscal year was slightly more than $28.2 billion. The federal share of the Medicaid spending in Ohio was about $19.8 billion in state fiscal year 2020, or 70% of program spending on Ohio Medicaid. Ohio's general revenue fund, or Ohio income tax revenue, contributed about $4.9 billion, or about 17%, to Ohio Medicaid program spending in state fiscal year 2020. And lastly, the remaining $3.5 billion came from other state services, including fees paid by hospitals, health insurance companies, and nursing facilities. Between state fiscal years 2010 and 2020, total state and federal spending on Ohio's Medicaid program grew by an average of 5.9% annually, from about $16 billion in state fiscal year 2010 to almost $28.3 billion in state fiscal year 2020. The graphic shown on the screen displays this growth over time for both the federal and state governments and shows the trend line for fiscal years from left to right. As a reminder, here are the 3 key findings for policymakers from Medicaid Basics 2021. If you have questions about my presentation or the overall brief, please type them into the question box. Now I'm going to turn it back over to my colleague, Zach, who will facilitate the question and answer session and provide closing remarks today.
Great. Thanks so much, Stephen, for all that information. And a few questions that we'd like you to respond to here. The first is, who qualifies for the fee-for-service program? We note that 7.4% of Ohio's 3.1 or 3.2 approximately million Ohioans are enrolled in fee-for-service, and that's about 230,000 Ohioans. So who are they?
Yeah, that's a great question. And we touch on that a little more in the brief, but I can definitely answer right now. So fee-for-service coverage, which, as I said, is classified different than MCP coverage by the Ohio Department of Medicaid, covers Ohioans with developmental disabilities and others living in institutions or who receive Medicaid waivers. And again, fee-for-service also covers some people who are dually eligible for both Medicaid and Medicare, as well as some Ohioans who very recently enrolled in the Medicaid program and have not been necessarily assigned to the MCP that they might eventually be able to take advantage of.
Great, thanks. And you just mentioned assignment to managed care plans, and we had another question about, is there a breakdown on how many people are enrolled in each managed care plan, and how do individuals pick the best plan for them?
That's another great question. The Ohio Department of Medicaid on its website has a number of resources related to managed care expenditures and the demographics of people as to how many Ohioans are enrolled into which eligibility categories. That's under the reports and research section of their website. I'm not entirely sure if Ohio Department of Medicaid publishes the exact numbers of or breakdowns of Ohioans who are enrolled in each managed care plan or MCP, but it's important to note that some individuals are enrolled in MCPs by the regions in which they live. Not all MCPs in Ohio are statewide. Others, however, have choices for the MCP in which they enroll, and either make that determination by doing their own research on Ohio Department of Medicaid's website, which provides a number of resources on the differences between MCPs, or by getting in contact with a representative from the Ohio Department of Medicaid. So for that question, I'd say definitely visit ODM's website because there is a wealth of resources on that topic there.
Yeah, and they've even got a website that explains the process of choosing a managed care plan and being assigned for those individuals.
Yeah.
The last question we had come in is what sort of medical conditions are covered under the age blind and disabled category? And the person who asked that question noted that such a large proportion of total Medicaid spending is for that group of individuals who are in age blind and disabled category.
Yeah, that's a good question. So in my presentation, I detailed the groups that are covered under the ABD category, which I'll reiterate includes Ohioans with disabilities, Ohioans who are enrolled in the Medicaid program but over age 65, Ohioans who are eligible for the Medicaid buy-in for workers with disabilities, and again, the dual eligible category. We know to be true that older Ohioans have more significant healthcare costs, and individuals with disabilities, whether they are developmental, long-term disabilities, or workers with disabilities who were maybe um, harmed in work, have significant healthcare costs. The specific conditions, however, are not as clearly defined, but it's more about the definition of disability.
Right, right. So thank you very much for responding to those questions. If you do have other questions about this presentation, you can always email Stephen or myself by visiting the Health Policy Institute of Ohio's website, which is hpio.net. As a reminder, all of the presentation slides and other related resources are available on this event's webpage. And we would just like to remind you that our HPIO, excuse me, HPIO's mission is to influence the policymaking process. And you all are doing that work. And we really hope that you will use the information in Ohio Medicaid Basics and in all of HPIO's publications to do that work. And here's just a reminder of some of the ways that you can engage with this policy making process. Again, thank you very much for your time. And you can check out our brief on our website. And please stay in contact with the Health Policy Institute of Ohio as you continue your work. Thank you very much. That concludes our webinar.